Namaskar, I'm Dr. Nitik. In today's video, I'm going to tell you about hypertension, commonly known as high blood pressure. Why am I talking about this disease? Is because these lifestyle diseases like hypertension, diabetes mellitus are very much rampant in our society today. Maybe some of you are suffering from it, or someone in your family or among your friends. Therefore, I hope you'll watch this video till the end, and today's video is loaded with information. And I'm not discussing it on medical science perspective, I'm discussing it on patient's perspective. I want to discuss this in a point wise. First of all, I'd like to tell you what is hypertension, what is high blood pressure. High blood pressure meaning your blood pressure is increased, but how much? There are so many guidelines. Personally, I follow European Society of Cardiology. According to them, if your blood pressure is more than 140 by 90, 140 is systolic blood pressure, 90 is diastolic blood pressure. These are technical terms you don't need to understand. I'm telling you in case if you're interested. Okay, so if your blood pressure is more than 140 by 90, then we call it hypertension. But the catch point is, just because your blood pressure is more than 140 by 90, you just cannot designate somebody as hypertensive, because there are so many parameters to consider. Sometimes because of age, sometimes because of wrong way of measuring it, sometimes because of the machine is defective, sometimes because of the other diseases causing hypertension. We call it secondary hypertension. So there are so many things to consider. So just because your blood pressure is more than 140 by 90, don't think that you are having hypertension. These are the incidents I encounter daily in my practice. Some people, they buy their own machine, BP measuring machine, and they come with that much number and telling me, I'm having hypertension, give me medicine. Sometimes somebody else measure the blood pressure who doesn't know anything about hypertension. But for your simplicity, for your understanding, I'd like to tell you one trick. Whenever you think your blood pressure is high, whenever you see your blood pressure is high, consult a doctor. Don't get treated yourself with quack. There are so many people I know who are over smart. We've been working with doctors and they see doctors are giving this, that, so they will also start giving you those medicines. But they don't know how these drugs are going to affect your body, why this drug is decreasing your blood pressure, and what will happen if your blood pressure is not treated. There are so many things. Medical science is not straightforward. It is not always 2 plus 2 equal to 4. Sometimes it is 2 plus 2 equal to 5. Sometimes it equal to 6. Sometimes equal to 3. Never get yourself treated with a quack. Get yourself treated with a doctor, because you deserve a doctor. Now coming to treatment part, how to treat hypertension. I'm not going to talk about medical science, because that is not for you. Here I'm going to tell you how to prevent yourself from getting hypertension, because once you get hypertension, it is going to stay with you forever throughout your life like a toxic person. So before you get this, it is better to prevent it from getting it. For that, you need to understand why there is increase in blood pressure. This is simple science. Let me explain you. There are so many things, but the main reason I'm going to tell you. Consider this is your pipe in your bagan for giving water to your flower, your plant. Suppose you're standing in one corner of your bagan and you want to give water to far end corner of the bagan. Then how do you give? You squeeze the pipe so that water flows with more pressure. Right. Exactly same thing happens with your artery, your body. With age, there is deposition in the lumen of your artery, and your artery become hardened also. So size of the lumen decreases with age, and if your size of the lumen decreases, blood flow with more pressure. That is the reason. That is the most important reason. There are so many reasons. Okay, sometimes because of blood volume increases. So many things are there. Okay, so the treatment is what? Prevention is what? You have to control the deposition. Why there is deposition? These deposition are composed of cholesterol. Cholesterol meaning fats. Why you get fats? Because you are not working out, you are lazy, you are eating unhealthy food. So that is a simple funda. If you don't want to get a toxic person throughout your life, then you have to work out, you have to eat healthy. Okay, don't be lazy. That is how you prevent yourself from getting it. And if you already got it, if you are already hypertensive, how to treat it? For that, you need to consult with a doctor, because you deserve a doctor. And in case if you want to talk with me, you can talk with me in Instagram for free. Now the last point is, what will happen if your hypertension is not treated? See, if your hypertension is not treated, you may get kidney problem, you may get brain stroke, you may get so many things, lung problem, eye problem, heart problem. Like heart attack. There is nothing like heart attack, okay, in medical term. I'm just telling you for your understanding. We call it ACS, acute coronary syndrome. Okay, here I want to give you one instance. I know one person who is already aged. He's hypertensive. He was taking medicine on and off. One fine day, he developed hemorrhagic stroke, meaning his blood vessel inside his skull ruptured and blood accumulated inside his skull. He started compressing his brain and he became paralyzed on one side, for which he had to go to Guwahati, where he had to undergo surgery in order to evacuate blood inside his skull, which costed him very much, which costed his time, his money, his health. The point I am trying to make here is that one tablet could have prevented this from happening. Therefore, it is better to prevent it from happening. I hope you got my message and I hope you like this video. Thank you so much for watching. Jai Hind.